The Senate's still working on the health care bill. Things have been changing. It's a moving target for sure. Nothing's etched in stone by any means. And I'm here right now with insurance broker Craig Gussin, and he has been obviously looking at this day by day, minute by minute, and you're keeping track of this thing because there's a lot at stake.
There's a lot at stake, and you know, the CBO came out, congressional budget came out the other day and said that the cost of group health insurance won't go up at all by year 2016. Individual rates will go up probably, they say, 10 or 15%. But when you really look at the numbers, what we found out was that the reason they're not going to go up because the benefits and the subsidies that will be kicking in at that point for a lot of the groups and individuals, they're expecting that we're going to get people to pay fines. They're expecting people on these Cadillac plans to pay the 40% excise tax. Well, if you have a Cadillac plan, you're going to pay a 40% excise tax. You're going to downgrade your plans. You don't have to pay a tax.
Right.
So they're going to lose all this tax money. And one of the biggest concerns...
These are all these budget estimates are based on assumptions that these things are actually going to go through.
Exactly.
People are going to pay those fines. People are going to continue the Cadillac plans.
And by doing that, that's where they're getting all this money to offset the cost of health insurance.
Right. But well, that's not going to happen.
Not at all. If you're an individual and you're going to pay a $90 a year fine for not having health insurance versus paying premiums, it's pretty obvious.
You're going to pay $90.
You're going to pay $90. One of the things that no one talks about that I just found out about recently, all the taxes, each state gets so much money from taxes. California is going to lose $150 million in taxes because of all this, because the taxes aren't going to be paid. The other thing is the exchange. The exchange won't allow people who have HSA, health savings accounts, high deductible plans, to have them in an exchange. So a lot of the people are also going to have to change plans. And when you start looking at the details of the bill, you realize it's not that great a plan. And again, I go back to the same issue. The people who are going to get hurt the worst are the seniors. The $500 billion cut that they're talking about, $500 billion cut in Medicare isn't going to be there. They're going to, I don't know where they pulled this number out of that they think they're going to cut this in the next 4 or 5 years. I don't see it. And
interestingly, the AARP came out and endorsed that yesterday.
AARP endorsed it for one reason. It's the only thing I can think of. AARP is a marketing organization. They make their money by people buying the PPO Medicare plans versus the HMO Medicare Advantage plans. People who have Medicare Advantage plans are going to lose them, mostly HMO type plans. And you have a senior not making a lot of money who's paying anywhere from $0 to $40, $50 a month for their HMO plan. All of a sudden, to get a comparable plan on a PPO, may have to spend $150 to $300 a month, depending on their age, to get comparable coverage, and they're going to go, I can't afford this. And that's a concern I have, is why is AARP doing this? It doesn't make any sense because...
Well, you say they're a political organization.
I think it's the only reason, and I've always been a big fan of AARP until this, because I'm going, you're not really doing what's best for the seniors.
Is there anything in this that you like as the insurance industry?
As a broker, what I love is that I can get everybody covered. Dan Plant comes to me and says, I need health insurance. I'll go, great, Dan, here it is. I don't care about your health history, anything you've gone through. That's the nice part. Everybody can get covered. We got to get tort reform to keep costs down. I want costs to go down. I have 21 of my groups renewing this month, and I got to go to all of them and say, your rates are going up. What can we do to make some changes?
How much are they going up?
Going up anywhere from 10 to 20%. Sometimes we've seen one as high as 50.
And this is before health care so-called reform. And as we were talking earlier, the health care premiums have gone up in the past year, maybe 30, 40% already.
The premiums have gone up a lot. You know, example you and I talked about in the last 10 years, rates have gone up 50 to 80%. Most of it's because of mandates. They keep on saying, we want you to cover this. The latest
you need to cover depression. You need to cover preventative. You need to cover a lot of things.
And every insurance company has to have on staff people that speak English, Spanish, Tagalog, and they're saying that's an insurance expense, not a medical expense. So all of a sudden, they have to increase costs to cover all these new people they got to hire.
What are in your opinion, what are the odds of this thing actually coming out of here looking anything like it looks today?
Slim and none.
Slim and none.
50-50 chance anything will be passed because, again, you look at the Senate. You got 5 or 6 Democrats on the conservative side saying, no way will we take a public plan. You got 5 or 6 liberal Democrats saying, if there's not a public plan, I won't pay for it. And the only way they're going to get it through is if they did what they did with the lady, the senator from Louisiana. They gave her $300 million for Medicare expenses just to get her to vote yes, to get one of the 60 votes to get it to the floor. So the debate is going to be
a little grease in the palm always helps, doesn't it?
You know,
I mean, that's amazing. $300 million to that woman.
to that woman to help Medicare only in Louisiana.
Only there.
So if you figure...
In exchange for her vote.
Right. So you figure 60 votes times $300 million, that's just going to add again to the budget. It's crazy what they're going to do, but there is ways to fix health care reform the right way, and we've gotten this far. Let's do it the right way and make it work for everybody and not get to a point where 20 years down the road, 30 years down the road, you can't get something done, maybe a hip surgery, because of all the surfing you've done, that you could get today because of the rationing they're going to end up having to do. Right. And that's my concern.
All right. Craig Gussin, insurance broker here in town. Best of luck to you.
Thank you. You too.
All right. We'll see you later.